So here's the section on physical activity in relation to the weight management lecture that unfortunately I didn't get through in the session. So what we're looking for in physical activity and our recommendations to people is that they reduce sedentary behaviour, which is not just to do with weight management, but also to do with the fact that sedentary behaviour is unhealthy in itself. So we're trying to encourage activities of daily living. So people to be using active transport, to be up and about doing gardens, jobs around the house, just being generally more active. And in some cases, we're going to be including structured exercise as well. So we're taking it from more than one standpoint, not just recommending people go to the gym, for example. So let's have a look at what the adult recommendations are. So this is for the general population. So we're looking at how to maintain health in adults, and we're talking therefore about active living daily, and at least 150 minutes of moderate aerobic activity, cycling, brisk walking, examples, every week, or 75 minutes of vigorous aerobic activity. This actually hasn't changed much since the previous recommendations. So vigorous can be running, tennis, squash, at the gym, all sorts of range of different things, football, it doesn't really matter what. Or you can have a mixture of those two. So it might be that you do have an hour's football training every week, but then the rest of that is made up, your 150 minutes is made up of brisk walking or cycling. So those kind of mixtures can work, plus strength exercises on 2 or more days a week. Some things that use major muscles rather than just one particular thing. So we should be using our legs, hips, backs, abdominal exercises, chest, shoulders and arms. So there's lots of different activities that people can do, including things like Pilates and yoga, but maybe weights. There's a whole host of different things that people could be doing. Minimizing the amount of time being sedentary, so trying to get people to get up and move rather than just sitting, watching TV, delivering lectures, listening to lectures, those kinds of things. So we need to encourage that bit of movement so that people aren't sitting for long periods of time. And there are lots of different tweaks to these recommendations depending on different age groups. It's proportional for children, but also that recognition that in the majority of people over the age of 64, their activity level is likely to go down. It doesn't have to, though. That's not a foregone conclusion. So I think we need to be mindful of looking at what people can do, but also being very aware that for our overweight and obese patients, 150 minutes is just such a long way away from what they do now. If you remember that 21% of the population do less than 30 minutes a week, we've potentially got quite a lot to be encouraging people to do. So it may have to be a step-by-step process to get up to that 150. So with our weight management people, we are encouraging increased level of physical activity. And I think it's really important to make people aware of what the health benefits are, both for physical and mental health. It's not about weight loss because you have to do so much in order to lose weight. So we're looking at least 30 minutes, moderate or greater physical activity on 5 or more days per week. So there shouldn't be more than 2 days a week where they're not doing anything. But prevention of obesity takes a lot more than that. 45 to 60 minutes of moderate intensity activity every day, particularly if energy intake isn't reduced. And I think this is really important to help people to understand that increasing physical activity is incredibly important, many, many benefits, but weight loss is not one of them. It because most people cannot do the amount of exercise that would be required in order for them to lose weight. So we've got to make sure that we're making a correct emphasis on it in order for it to support people losing weight. So it becomes incredibly important in weight maintenance, which we've been talking about. So those who have been obese and lost weight may need to do 60 to 90 minutes per day to avoid regaining weight. That's a huge amount. It really is a huge amount. So it can't just be activity. The diet side's got to be encouraged at the same time. So we might be encouraging people to build up towards those recommended activity levels. And genuinely, you might be suggesting that people start walking to the nearest street light on their street and back, or then walking to the next one and back, and then perhaps trying to do it a little bit further, and then perhaps trying to do it a little bit faster, so that in order to get to that moderate level of physical activity. And what is moderate for one person may not be moderate for another. So when we talk about moderate activity, we're talking about activity that makes people's heart rate go up a little, should make them be breathing harder, and they should still be able to speak, but they might find that a little bit more challenging. So it's moderate, your moderate, my moderate may be very different pace or level of activity. So it's about what works for that individual. So we really may be talking very small steps, using the upstairs toilet rather than the one on the ground floor. So that you're bringing in some stairs. It's simple things sometimes with people that they have to start on in order to build it up. But that's what you might well be having to do. What can that person do? And sometimes simply the fact that they can get upstairs easier than they used to be able to is a real bonus and a real encouragement to people that they can actually do it and get through that piece of activity without difficulty. So genuinely, we were talking about brisk walking, gardening, cycling, swimming, working up the step level, stair climbing, those kinds of things. So it might be really basic things, activities of daily living that perhaps done a little bit faster or just a little bit more, working towards those goals. So you've got to start where they're at and move from there. As they can be a long way from what the actual recommendations are. So we start with goals, simple goals, then up to that 30 minutes of walking, for example, then up to 60 minutes a day. And you can use this whole idea of 10-minute chunks. There's quite a good evidence base for that. So if people can't do 30 minutes, which a lot of people cannot, then they start by doing 10-minute blocks. And 6 10-minute blocks will get to that magic, but not evidence-based 10,000 steps a day. It isn't evidence-based, the 10,000 steps. You can do 10,000 steps without getting to that moderate level because it's not necessarily getting your heart rate up. But actually, 30 minutes of walking is nowhere near 10,000 steps. It's more like about half of that. So the 10,000 steps is a goal. It's a nice round figure for people to aim towards. But the 30 minutes of walking and moderate activity has a much better evidence base. Really good idea to have a diary or something that you can monitor what you're doing. And this could be a great encouragement. Self-monitoring is a good evidence-based thing to do anyway, but not just with food, with physical activity. So people can say, well, actually, yes, I went to that streetlight this week, but following week I was able to do it twice as far. And then the following week I was able to do more. So people can see that they are improving and see that their fitness is going up, even if it is still at a very low level. For those of our patients with insulin resistance, which will be a lot of them, we're looking at increased levels 3 times a week of 60 to 90 minutes of aerobic activity. And it might be walking, it might be, some people will go to the gym. It's for some, it might be dance. It's about finding what really works for that individual, and some resistance training as well, because when people lose weight, they may well lose muscle mass as well, as you are aware. So we want to try and preserve that muscle mass as much as possible. As you know, that's the most active tissue, burns up the most calories. We want to keep the lean body mass as much as possible. And the physical activity also increases that. So really be mindful of that. And we briefly spent a little bit of time talking about the barriers to physical activity, the cost of equipment, the cost of using leisure services, the transport, the lack of green spaces, the lack of safe spaces, the health conditions that people have may actually get in the way. So there's a lot of things to think about. And it's really helpful when we're setting goals with people to make sure that they think through what the barriers are so they can find a way to overcome them. So that's part of what we might be doing, not just setting a goal, but then saying, so is that going to be feasible for you? Is there anything that's going to get in the way of you doing that? It might be time or work or childcare. A whole host of different things, but very individual. So what might get in the way? What might stop you doing that? And work from there, so you can try and make goals that people are actually going to be able to attain.